Hey everyone, this is Steph from optimizeyou. Today I'm going to teach you how to use a foam roller to treat the hips and help lower back pain. So with everyone being at home during this time, you have a lot of people working from their kitchens and their living rooms and their couches, and they're sitting in weird positions. You have people trying to figure out how to move and exercise without having access to their gyms or their classes. So you have more people doing online workouts from their living rooms or doing different routines. Or even on the flip side, you have people who are way more sedentary than they're used to being just by nature of having to be inside so much. Also, people don't have access to their normal therapies, things like acupuncture and chiropractic care and physical therapy to help them manage muscle pain or tension. So as a result of all of this, many people are struggling with lower back pain. It's really one of the most common issues that people have. It's something we treat in our patients all the time. So let's talk about how to treat that using this simple therapy tool, the foam roller. So most of you know what the foam roller is. This is mine. You can use anything that you have at home. There's lots of different kinds. Some are softer, some are harder, some have little knobs on them. Whatever you have, just use that, whatever works best. Foam rolling is a self-myofascial release technique, which essentially means self-massage. And for those of you who don't know, fascia is a thick, fibrous connective tissue that encapsulates every muscle and every structure in our body. It's what holds us together. Now, there's a lot of benefits to foam rolling. I think the most important one to talk about is that it improves circulation so that you have oxygen-rich blood flowing to tissues. And that's really one of the biggest indicators of health in Chinese medicine, so I really appreciate that one. Foam rolling is helpful for faster tissue recovery. It helps with improved flexibility and range of motion, helps with injury prevention, and then of course, pain relief. So a couple of things to know about the correct way to foam roll, because I see a lot of people out there doing it wrong. The first thing is to go slow. It's really the most important thing, because the point of using a foam roller is to release tension in the muscles by breaking up what we call fascial adhesions, those little knots or trigger points that you feel in the muscles. Now, we get these adhesions as part of the normal fascial repair process. The fascia can get stuck or like bundled up, and that in turn restricts the muscle that it encapsulates. So I see a lot of athletes and a lot of patients use the foam roller, which is great, but they're rolling up and down an area really, really quickly. And this just isn't effective to break up adhesions. First, it's too fast. Second, it just makes us tense because it hurts. You want to go slow. Find a trigger point or a sore spot, spend 20 to 30 seconds on each area or adhesion, and then move on to the next spot. Also, make sure you are breathing and consciously relaxing the muscle as you work, because we tend to tense up without even knowing it. Secondly, really apply the most pressure when moving in the direction of the core or the heart. And this isn't something that a lot of people talk about, but we know from earlier that foam rolling helps with blood flow. And the vascular system is made up of arteries and veins that have one-way valves. This helps prevent backflow of blood. Now, veins return blood to the heart. So to be easier on the blood vessels, use the most pressure as you roll up a muscle towards the core. Now, for lower back pain, something that people often forget to address is the glutes, the glute muscles. Now, the glute muscles are the foundation for our lower back. And if these foundational muscles are disengaged, tight, weak, or turned off, we don't get the proper support we need for the muscles in our lower back, like the lumbar paraspinals, the muscles that are close to the spine, or the quadratus lumborum, or the QL. We call it the QL. And that's a deeper muscle. It acts as a stabilizer for the lower back. If you've ever leaned over and used your lower back to lift something, you definitely know what I'm talking about here. So to start, let's start with the glute max. It's the biggest muscle in the glutes, right in the center. And you just sit on your foam roller with your weight on one side, find a trigger point, and just stay there for your 20 to 30 seconds. Now you notice I have a stabilizer leg here. It helps me control my weight, and then I'm using my arm on the floor to control my weight. You can cross a leg over and get into some of those deeper muscle fibers, bring them up to the surface. Remember, fascia doesn't move in one direction. It actually crisscrosses over itself, so you might have to foam roll in different directions also to get your best result. And you can just find little knots and stay there and then move on to the next spot when you're ready. The other glute muscle that's important is the glute medius, and it's a thinner muscle right on the side of the hip. You want to turn to the side here, find the muscle right behind the greater trochanter head, so that bone in the hip, And then just lean onto the forearm. You can be on the wrist or the forearm, whatever feels good. You still have your stabilizer leg, and you're just working into that muscle. Now this glute medius muscle is a stabilizer. It helps keep the whole leg on track, so you really want to pay attention to that muscle. You can also get into the hip flexors. Just pop a stabilizer leg out here, turn forward, and you're working right in the front of the hip. Find a little spot. You can rock there 20 to 30 seconds. Do both sides, find all that tender spots. Make sure you're working in the muscle belly. And then finally working in the lower back. So you can get into the quadratus lumborum. This is a deeper muscle. It's deep to the paraspinals. So you kind of have to turn slightly to find that thick edge of the muscle of the QL. Now this can be a very tender, sore spot for people, so just be gentle. Go at your own pace. I've still got my stabilizer leg here. I'm on my forearm nice and steady and just controlling that weight. Now, a couple of other things to help with pain and muscle tension. First, stay hydrated. Aim to drink half your body weight in ounces of water per day, and that's a pretty good bet. You can foam roll before and after exercise if you want, but afterwards is enough, and it's especially helpful in alleviating tightness and tension as a result of your workout. And then finally, just move a lot, move often. Try not to sit on soft surfaces for too long or bent over, being in weird positions. Your best bet is to move around the house every 45 minutes and stand upright and just stretch a little bit. A couple of things to just watch out for when you're foam rolling. Try to avoid rolling the bones or the tendons. Aim for the muscles around these structures instead. You'll get the best release by working in the muscle belly rather than the tendony, sinewy structures there. Work in the thicker parts of the muscles. And then just be especially gentle when you're foam rolling the lower back. We don't have a lot of bony protection from the rib cage down in the lower back, so our internal organs are a little more exposed there. Just be gentle. Now, I hope this alleviates lower back pain and tension. Remember, if you take care of your glute muscles, if you keep them strong, engaged, and you're not carrying a lot of tension in the hips, your lower back doesn't have to carry as much of the load. So remember to take care of your body and to take care of each other. Thanks. The project is you.